Good morning, everybody. So today we are from SGDB10. We'll present about our student project entitled Management of Generalized Tetanus. So this is our SGD members, and this is the contents of presentations. And let me start from the backgrounds. My name is Putra Landere, and I'm number 11. So tetanus is an infection that is characterized by generalized hypertonia and manifests as spasm of the jaw and neck muscles, which is felt as pain by the patient. And tetanus is caused by the infections of bacterium Clostridium tetani, which can be found in soil, dust, and animal feces. And tetanus is a disease that can infect people of all ages and is more common in areas with warm climates and is more common in males. The highest prevalence of tetanus is reported to occur in newborns and young people, especially in neonates and children in countries that don't have immunization programs. The disease is also common in those who have not been vaccinated or in older people with reduced immunity. Tetanus can be classified into four main types based on the clinical manifestations. Those are generalized tetanus, neonatal tetanus, localized tetanus, and cerebral tetanus. And generalized tetanus is the most common form of tetanus, and about 80% of all cases of tetanus is belong to the generalized type of tetanus. And also, generalized tetanus is associated with a mortality rate of 10 until 20% with modern intensive care. So, judging from how this disease can be life-threatening, we decided to discuss the management of this disease in this paper.
My name is Butika Dharmautra with name 024. Research question. The research question of this writing include what is the definition of tetanus? What is the epidemiology of tetanus? What is the etiology and risk factor of tetanus? How is the pathophysiology of tetanus? How to diagnose tetanus? What is the management of tetanus? And what is the prevention of tetanus? Purpose. Based on the research question, the purpose of this writing are to understand what tetanus is, to understand the epidemiology of tetanus, to understand the etiology and risk factor of tetanus, to understand the pathophysiology of tetanus, to understand how to diagnose tetanus, to understand the management of tetanus, to understand the prevention of tetanus. Next is the benefit. The benefit achieved from this writing are: first, public can get new knowledge regarding tetanus. Second, medical community can further understand about the pathophysiology, diagnosis, differential diagnosis, and management of tetanus. And the last is authors can enhance their knowledge about tetanus.
My name is Pierre Joshua, last digits of the number 077. So we will start with the definition of tetanus and general tetanus. So tetanus is a neural disease caused by bacterial infection. The bacteria is Clostridium tetani, which is a gram-negative obligate anaerobic bacterium that can produce exotoxin. This exotoxin is what causes the symptoms of tetany. And for general tetanus is one of the classification of tetanus that most commonly found, happening around 80% of the cases. General tetanus is classified by the clinical signs and finding besides neonatal, localized, and cerebral tetanus.
Hello Dr. and friends, my name is Vindu Fernand Valentin with order number 086. Tetanus affects all age, but is most common in male in areas where the soil is cultivated and in warm climates. The incidence of the rises following natural disasters such as earthquakes and tsunamis. And tetanus is not a notifiable disease in most countries, so the prevalence of true disease is unknown, while the mortality rates have improved in recent years as a result of aggressive vaccination campaign, from 275,000 deaths in 1997 to 14,000 deaths in 2011. Mortality rate affected by availability of research such as mechanical ventilation, invasive blood pressure monitoring, and early treatment. And tetanus usually contracted through skin laceration, but also can be spread by otitis media, poor dentition, and non-sterile surgical instrument. The vaccination was available to approximately 80% of children under the age of 12. in high-resource countries occurs in unimmunized or the elderly whose immunity has weakened over time. And tetanus primarily affects the developing world, where the incidence rate is 135 times higher, with mortality rates ranging from 20 to 45%. Thank you.
Good morning, doctor and friends. My name is Putri Tamia Disrianti with NIM 081. Etiology of tetanus. Tetanus is caused by infection from the bacterium Clostridium tetani, which is a gram-positive, spore-forming, and obligate anaerobic bacillus. This bacteria can be found in soil, dust, or animal waste. Tetanus spores can survive for a long time in certain environments, especially in areas with hot and wet climates with soil rich in organic matter. Clostridium tetani spore can survive in a dormant form for years, are resistant to sunlight, heat, and disinfectants. These bacteria are not active until they find a place to grow. When bacteria enter through wounds on the body, which are good conditions for growth, cells will actively grow and divide. Clostridium tetani spores will turn into vegetative form and release the toxin tetanus plasmin. The toxin damages the nerve in the body that control or muscle or motor nerve and cause the symptom of tetanus. Clostridium tetani can enter the human body through puncture wounds, laceration, broken skin, or inoculation with infected needles or insect bites. Generally, the source of infection is a minor wound, such as a small laceration from wood, chips, metal, or thorns, so most people do not notice when they have tetanus.
Good morning, doctor and friends. My name is Shannon Kaista with student number 051. Now I'll continue the presentation. Next is about the risk factors of tetanus. Here are some of them, which are: first, are not immunized, have a history of incomplete immunization, or are immunized but lack of a booster dose. Second, open wounds or when exposed to contaminated sharp objects are at risk of developing tetanus. Third is because of surgical procedures, intramuscular injections, compound fractures, dog bites, and injecting drug users can also develop tetanus. Fifth are patients with immunosuppression, burns, wounds from diabetes, and as a result of chronic disease conditions such as abscess and gangrene. And last but not least, dental infections after tooth extraction, root canal treatment, and trauma to the soft tissues in the mouth may lead to tetanus. And on the other hand, there are also some risk factors for neonatal tetanus, which are due to childbirth and unsterile cutting of the umbilical cord, unvaccinated mothers, deliveries carried out at house or places with dirty surfaces and not assisted by trained medical personnel, previous children history of neonatal tetanus, and also infectious materials or traditional tools applied to the umbilical cord. These conditions may lead to neonatal tetanus. That's all from me. Next will be presented by my friend. Thank you.
Om Swastiastu, my name is Chakurai Sintan Ramskoti with digit of student number 231, and I'm going to explain about the pathophysiology of tetanus. So Clostridium tetani is the main pathogen of tetanus infections, and this spore-forming pathogen is an obligate anaerobic bacterium which found in soil and feces that release two types of toxins. Those are tetanus plasmin and tetanolysin. Tetanus plasmin, also called as tetanus toxin, which is neurotoxin that induces classical muscle spasm. Meanwhile, tetanolysin role in human tetanus remains unclear and not well understood. So tetanus toxin is a zinc-dependent metalloproteinase that targets a protein called vesicle-associated membrane protein, and this VEMP role in triggering release of neurotransmitter from nerve endings by way of fission of synaptic vesicle and neural plasma membrane. Next. So first, Clostridium tetani entered human's body through a wound area of the body, and then tetanus toxin splits into two chains, and the heavy chains travels into the central nervous system through two routes. The first route, toxin enters the bloodstream, which is not capable to cross the blood-brain barrier, so this toxins then travels into peripheral nerves. Later, it will bind to the presynaptic terminal nerves. Hereafter, the toxin inside terminal nerve will transport to the nerve cell body through the second routes called retrograde intraneuronal transport, which allow these toxins to eventually enter the central nervous system. And once tetanus toxin reaches spinal cord and brainstem, toxin migrates to the cell bodies of inhibitory neurotransmitter, cleaves with VMP, and which result in inhibit release of both gamma aminobutyric acid, and glycine that normally serve as skeletal inhibitors. So it will causing loss of normal inhibitory control and excessive response to external stimuli, which initiate muscle contraction and thus leading to clinical characteristic of tetanic muscle spasm or muscle rigidity. So the clinical triad manifestation of tetanus is usually mentioned as muscle rigidity, spasm, and autonomic dysfunctions. And general tetanus is the most common presentation, which manifested with trismus or lockjaw, neck rigidity, stiffness, dysphagia, reflex spasm, and autonomic instability. Next.
Hello, my name is Mani with the last three-digit name of 249. Today I'll be talking about the diagnosis of tetanus. Doctors diagnose tetanus based on a physical exam, medical and vaccination history, and the signs and symptoms of muscle spasm, muscle rigidity, and pain. A laboratory test will likely be used only if a doctor suspects another condition causing the signs and symptoms. Tetanus can start from an injury such as scratch, a cut or bite from an animal or another person. Some affected people may experience only pain and tingling at the wound site and some spasm in muscle near the injury site to start with. As things progress, there can be stiffness of jaw, called lockjaw and neck muscles, irritability, and difficulty swallowing. Thank you, that's all from me today.
Hello everyone, my name is Putu Emilia Dewi with student number 028 and I will explain about the management of generalized tetanus. There are several tetanus management goals. The first one is tetanus toxin neutralization. This step should be done immediately as the diagnosis of tetanus is confirmed. The passive immunization using HTIG or human tetanus immunoglobulin 500 IU intramuscularly or ETIG or equine tetanus immunoglobulin 1,500 until 3,000 international unit intramuscularly or intravenously is used to neutralize the extra tissues toxin. The second one is Clostridium tetani eradication and wound debridement. The drug of choice of Clostridium tetani eradication is metronidazole 500 mg intravenously that given every 6 until 8 hours a day. Penicillin G also can be given as an alternative medication in 2 until 4 million units dose intravenously every 4 until 6 hours, and the duration of treatment usually take 7 until 10 days. Wound debridement is also important because it may help eradicate spores and necrotic tissues from the wound site. The next one is muscle spasm control. WHO recommends a separate and quiet location in intensive unit care or ICU for the management. The location or room should be shaded and protected from any tactile or auditory influence as much as possible. Benzodiazepine like 5 mg of diazepam is also known to be beneficial in treating tetanus muscle spasms. Phenobarbital, propofol, and chlorpromazine were also reported to be effective in treating tetanus. For a prolonged period, neuromuscular blocking agents and intermittent positive pressure ventilation are also recommended as a therapy. The last goal is tetanus complication treatment and supportive care. Some complications may appear in the generalized tetanus cases, namely cardiovascular instability like hypertension and tachycardia that are mainly caused by the sympathetic reflex increase. Continuous intravenous administration of 0.5 until 1 mg per kilogram morphine per hour is very useful for cardiovascular stability. Beta blockers are usually used to treat tachycardia and tetanus, and magnesium sulfate is also commonly used to treat tetanus complications because of it acts as calcium antagonist that will be beneficial to control spasms. Tetanus patients often lose weight and have malnutrition, and therefore the nutritional approach is important as a supportive care. The risk of airway obstruction, sepsis, and ventilator-associated pneumonia or VAP also need to be assessed and monitored routinely in an inpatient.
Hi everyone, my name is Daniel Sulungu Tamasiro Ringo with the last student number 045, and I'm going to explain the prevention of generalized tetanus. Tetanus can be prevented by performing appropriate wound care and patient management. These are recommendations for clinicians to prevent tetanus. First recommendation is to determine the type of wound and give appropriate wound care. There are several wound types, may be clean or contaminated, superficial or deep. Dirty wound increase risk for tetanus, necrotic or gangrenous wound, frostbite, crush injuries, avulsion fractures, and burns are good environment for Clostridium tetani to proliferate. Clinicians should clean all wounds, remove dirt or foreign material, and remove necrotic material to prevent Clostridium tetani infection. The second recommendation is to evaluate the immunization status of the patient. Unvaccinated patients should start and complete a 3 dose of primary series of tetanus vaccine, DTaP, TDAP, and TD. Consider patient with unknown or uncertain history of vaccines as patient with no previous tetanus vaccine. Patients who have not complete 3 doses of primary vaccine should complete the vaccination. For patients who have complete a 3 doses of primary tetanus vaccination, if the patient received it less than 5 years earlier, they are considered protected against tetanus, so they don't need another dose of tetanus vaccine. However, if the last dose of tetanus vaccine was received 5 or more years, they need a booster dose of tetanus toxoid containing vaccine. The next recommendation will be presented by my friend. Thank you.
My name is Jonathan Edmond with student number 137. Right now I'm going to continue to explain about how to prevent generalized tetanus. So the next step is to assess needs for administering TIG for prophylaxis. Tetanus immune globulin or TIG gives temporary immunity towards tetanus toxin. TIG may help remove unattached tetanus toxin. However, it cannot neutralize toxin that is already attached to nerve endings. TIG is given to patients who have contaminated and dirty wounds and are either unvaccinated or have not received tetanus toxoid containing vaccines. Patients with HIV infection or severe immunodeficiency who have contaminated wounds, including minor wounds, should also receive TIG, regardless of their history of tetanus immunizations. TIG prophylaxis administered intramuscularly with the dose of 250 IU. Last of the prevention of tetanus is that medical experts do not recommend antibiotic prophylaxis for tetanus. However, clinicians should observe wounds for signs of infection and precisely treat them if they detect signs of infection. Thank you very much.
Hello, my name is Christian Rawan, student number 040. So the summary of this topic are tetanus is a disease caused by infection of Clostridium tetani that enters through the skin laceration. Currently, the prevalence of tetanus have decreased with the more cases in the developing country. Symptoms of tetanus are caused by tetanus plasmin or tetanus toxin, which affect the nerve and cause muscle spasm. The diagnosis of tetanus is based on physical exam, medical and vaccination history, and the signs and symptoms of muscle spasm, muscle rigidity, and pain. Management of tetanus can be done by giving TIG immunization, giving metronidazole antibiotic, wound debridement, and muscle spasm control with the use of diazepam and phenobarbital or chlorpromazepine. Meanwhile, to prevent the tetanus can be done by cleaning the wound properly and giving TIG if necessary. Next. Okay, that's all from us. Thank you very much for your attention and goodbye.